An intense workout or a stressful situation can cause the heart to pound at a fast rate, and sometimes people mistake heart palpitations for a more serious condition.
Atrial fibrillation, or AFib, is a heart condition that can happen to anyone at any time. If ignored, it can lead to a stroke or even heart failure.
September is AFib Awareness Month, and that's why morning anchor and health reporter Kirsten O'Connor spoke to an electrophysiologist from Orlando Health in today's Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
And that's right, atrial fibrillation is extremely common. 1 out of every 4 of us, as soon as we reach the age 50, will experience this. So the most important concern is decreasing your risk of having a stroke. And one alternative to lifelong blood thinners is a medical device about the size of a quarter, known as the Watchman device, that Dr. Aurelio Duran implants.
It's a small umbrella that we open up through little tubes that we put through the veins in the left upper chamber of the heart, where these blood clots form that unfortunately in some patients can dislodge. The Watchman umbrella, the Watchman device, allows us to move away from anticoagulants in these individuals and protect them without lifelong blood thinners, so that they don't have to worry or experience the terrible consequences of a stroke. And we just implanted our 200th device in the past few days.
Very exciting developments in the tech field, according to Dr. Duran. And some people are trying to use smart watches or even, those bands as they're exercising to alert them of an irregular heart rhythm. They are, of course, advancing. I asked Dr. Duran if he thinks that really works.
I think that those things are of great value in assisting in the care of individuals, especially in personal screening, but they really don't substitute the ability for someone to sit, speak with you, ask you the right questions, which sometimes are subtle and patients may not be aware are important. Are you having palpitations? Are you having dizzy spells? Do you feel skip beats in the middle of the night when you try to go to sleep?
And he also mentioned if you're not wearing that watch or device all the time, like when you're sleeping, it can be missing some critical information. One thing the doctor does want us to all pay attention to is new or different pain in your chest.
So for the most part, the heart beats very efficiently, but very silently, and we're not aware of it. Palpitations in some people can feel a twitch on the left side of the chest. Some people feel it in their throat or their neck, but it's some quivering type of sensation that's not a normal sensation. It's not always the heart that does it. It can be muscles, it can be in the chest wall, it can be in the swallowing tube, the esophagus, but palpitations can occasionally come from the heart, and again, there's something that needs evaluation.
So again, this device that Dr. Duran implants is something that they're really advancing and getting at least 200 patients to see success with. And that means they don't have to take daily blood thinners anymore, which he says is really an amazing thing for patients. He does expect there to be more advancements with the Watchman device in the future.